taking stock of health care reform. Is it big on health and short on reform? As the Senate struggles to find ways to pay for its plan, something called the CLASS Act may get closer attention. CLASS stands for Community Living Assistance Services, and it aims to provide long-term care insurance. Now, former Oklahoma Governor Frank Keating is watching how this plays out. He is the CEO of the American Council of Life Insurers, and he joins us now from Washington, D.C. Frank Keating, welcome to the program.
Thank you, Pimm.
Frank, give us a little bit of insight into what exactly is the CLASS Act and what is it trying to do?
Well, long-term care insurance is a life insurance product, not a health insurance product. This particular provision, providing a government long-term care program, has had no hearings, no debate, and with 70 million baby boomers soon to retire, this issue of long-term care, nursing home, at-home, Meals on Wheels should be subject to a lot of exhaustive study, debate, and analysis. But what this bill would do simply is provide $50 a day benefit to an individual who, perhaps in the case of a young person, will retire 40 years from now at a cost of about $110 to $120 a month. The problem is it costs $200 a day today for nursing home care. If you're poor, you're on Medicaid. If you're rich, you take care of yourself. The people in the middle, about 1 out of 5 Americans has long-term care insurance. It's affordable. It's provided by 89 companies. We had to let the private sector handle this first before the government comes in, but the government is in as a part of this health care debate, and it's too bad because it's simply not a wise public policy decision.
But, Frank, don't proponents of the CLASS Act look at this as almost like a Medicare system where there would be some benefit provided by the government, and then the slack would be taken up, let's say, by some form of private long-term health care insurance?
Well, Medicare is virtually insolvent, and in this case, our actuaries and the National Academy of Actuaries tell us that this system will be insolvent by the year 2029, even though the Health and Human Services Secretary will set the premium amount. Well, long-term care insurance in the private marketplace is considerably less expensive even today than this particular price program would be on the part of the government. When the government touches these kinds of issues, costs go up, efficiencies decline. It is quite truthfully, a solution looking for a problem. There is no problem. Let the private sector work.
And so, having said that, what about the private sector? I mean, are they going to be able to offer the kind of long-term health care insurance that would meet this problem at a cost that people can afford?
Well, Pimm, I'm 65. I brought a long-term care insurance policy. My wife did as well. About 3 or 4 years ago, my now 85-year-old mother-in-law bought one when she was 79. They are affordable. There are many different varieties, many different bells and whistles you can have on a long-term care policy. But this really is a bait and switch. Would I go as far as Kent Conrad, senator from North Dakota's description as a Ponzi scheme? I don't know. But it's bad public policy for the government to proffer a benefit of $50 a day when you need $200 a day, and you're dragooned into the system. My 29-year-old son, for example, if he signed up for work and he was a part of this, he didn't realize he could opt out. He can't opt out for a year, and he can't get any benefits for 5 years. The purpose of this whole thing is to raise money for the health care system. This $72 billion, allegedly, that the long-term care piece, the CLASS piece, will provide, doesn't go into a savings account. It is being spent, which means 10 years from now, 20 years from now, this particular government program will be insolvent. It'll either have to be moved into another hugely expensive and inefficient government entitlement, or it just simply won't survive. It's just not good public policy.
All right. I want to thank you very much, Frank Keating. He is the CEO of the president of the American Council of Life Insurers, talking about the CLASS Act provision of the health care reform bill, the Community Living Assistance Services and Supports Act.